afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for this week. I'm honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We'll have our written report for the weekend case numbers, hospitalizations, other critical information. It will be with you before 3 o'clock today. And in addition, the surgery numbers, which typically we do on Tuesday, will be provided later in the week, the number of surgeries canceled. So you'll expect that later in the week, and those other numbers will come in our written report before 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today I'd like to provide the latest update on our ongoing COVID-19 public health response. For many months now, as I don't need to say, I think, as COVID-19 continues to circulate in our communities, I've been asking everyone to take steps to protect yourself and those around you. And those steps remain as relevant and as important as ever. As we learn more about this virus, we have adapted our approach, and with us, step by step, have been millions of people in British Columbia. We've seen now how interconnected we all are, that the choices we make affect not only our own health and well-being, but it affects the health and well-being of our communities, our families, and our province. And we're seeing that with the challenges that are faced in different parts of our province. The actions we take or choose not to take affect the children in our lives, affect our elders and seniors, our neighbors, our friends. And we know the numbers over this past weekend have been stable, but they are still very high. And that means that we've had, again, increasing impact on our hospitals and our critical care. With this in mind, I'd like to address the situation we are currently facing in BC's north. We have been closely monitoring the situation in the north, and my public health colleagues and I are very concerned with what we continue to see in many communities across the north. COVID-19 is spreading at a higher than average rate. People are becoming severely ill, even young people, mostly unvaccinated younger people, and hospitals are pushed to the limit across the north. This is directly related to the vaccination rates in the communities where people are living. Communities with lower rates of immunization have higher rates of spread. The illness and the risk for everybody goes up. To address this, we have already put in regional health orders and are actively working with the Northern Health, my colleagues, to determine what additional measures we may need to break the chains of transmission across many communities in the north. For everyone, and especially people in the northern BC communities, we need to get back to the basics, the things that we know prevent transmission of this virus that we transmit to the people we are closest to, our family, our friends, our loved ones, our communities. We need to determine if there's additional measures that we need to take as well, and we need to ensure we're using all of the layers of protection we have available. That means washing your hands regularly, staying home when you're unwell, wearing your mask, particularly when you're around other people who are more vulnerable and in indoor public spaces, keeping a safe distance from others, and also getting vaccinated. It is not too late to make a difference for your own health and to protect your healthcare system and your community. We are also looking at whether we need to use booster doses in certain communities as a way to manage some of the severe illness and the outbreaks that we are seeing. We know that private gatherings, ceremonies, funerals and celebrations are a source of transmission, and it's transmission not just within a community, but people going from community to community. So I also want to remind the organizers of these types of gatherings and faith leaders in particular to ensure that you are using the guidelines that we have in place to protect your congregations, that you're ensuring everybody wears a mask in the indoor spaces, that you are carefully considering how or if people are coming together with high risk in communities right now and making sure that you can provide those virtual and online options that support people, particularly people who are more susceptible to severe illness or death from COVID-19. During this time of high risk, we need to go back to those basics, those things that helped prevent transmission in our communities. And what I'm asking people to do is not new, but we know it works. And those communities that are impacted now, we are seeing the effects of the stress on our healthcare system in the north, and that means people being transferred for critical care, and we know how stressful that is on families to not be able to be with their loved one when they're in serious condition. My healthcare colleagues across this province are also stretched, and we are tired. It's been a long 20 months, and I don't need to say that to people in British Columbia. It is so hard for us to see a preventable illness now affecting people across the province. And that is because we need to get vaccination rates up to protect people from having severe illness. A number of things that we are doing right now. Today, the provincial health order, the provincial health officer order requiring COVID-19 immunization for all those working in long-term care and assisted living has come into effect. And a similar order will be in place for acute care and community care that will come into effect later this month, and that order will be posted later today. Together, these orders apply to healthcare workers in all settings and all workers in healthcare settings. It is very broad for the very reasons that we know that these are settings where transmission causes strain on the system if healthcare workers are infected, but also can mean transmission to those who are most vulnerable to severe illness. I want to thank all of the healthcare workers who, for your own reasons, may have delayed getting your vaccine, but have now taken this important step. It is not too late. Few know better than those working in long-term care and assisted living what the impact of COVID-19 has been on our seniors and elders, particularly those who live in long-term care. As our seniors advocate has highlighted, it is these people who have suffered the most, both from COVID itself, but also from the measures that we've had in place to try and protect people. And I am incredibly grateful that you are doing all you can to support them and keep them as safe as possible as we weather this next phase of the storm. It is also important to know that this is a measure that protects you as a healthcare worker and keeps you able to care for those who are more vulnerable. It protects our healthcare system, our families, and our communities. I recognize as well that our public health mandates have changed over time, and they will continue to do so as the pandemic evolves and changes. And just as we may increase or decrease public health measures to ensure our protections are in step with our risks, we also want to keep things as straightforward and as simple as possible. So recognizing that young people are now wearing masks from K to 12 in our school system, I'm adjusting our public mask mandate and requiring it for everyone 5 years of age and older to wear a mask in all indoor public spaces. And that will be posted in the updated order today. For youth, whether taking the school bus or the city bus, the rules are the same. And I just want to say how impressed I am. I continue to be amazed at the adaptability and the resilience of children across this province, and many of them have told me that that they know how to wear a mask now, and that it's something that they do to keep themselves safe, to keep their families safe, and I just want to say thank you. We are also, as you may have heard, readying our province to be able to provide COVID-19 vaccines to youth 5 to 11 years of age as soon as the vaccines are approved for use by Health Canada. And we have heard that at least the preliminary data package has been submitted to Health Canada, and we may have that important vaccine available to us as early November. So we continue to talk with school communities, families, and parents to ensure the process will be as seamless as possible for everyone and make sure that our logistics are all in place so that we can provide this vaccine as soon as it's available. In the meantime, parents can now pre-register your children in the same way that we have registered ourselves or older children over the past year and a half. Notification of eligibility to book an appointment will be provided as soon as these vaccines are approved for use by Health Canada, and we have a sense of when they're going to be available to us in the province. So we are continuing to do what we need to do to make sure we can roll out that program to protect younger children as soon as the vaccines are approved. I'm also very pleased to see more and more businesses across BC and across the country are bringing in vaccine requirements in their workplaces. And we know that this is something that will protect employees, will keep workplaces safe, and keep businesses functioning safely. So I encourage everyone to take this important step as well. The COVID-19 pandemic has evolved, and so have we. And we need to continue to evolve to deal with each new twist we are faced with. We will continue to be nimble in our approach and adjusting as needed as we continue to weather this storm together. Things have changed and will continue to change, and as many people may have heard, the U.S. has recently announced some changes to their upcoming requirements for travel to the U.S., and they have recognized AstraZeneca, which is an important step for I know many people in this province who receive that really important vaccine. I know they are also continuing to look at mix and match vaccines, as many countries around the world, the UK, France, Italy, ourselves, have used these important combinations. And the data that we presented here from BC and from across Canada shows how effective the mix and match combinations are. And I know our colleagues in the US Centers for Disease Control are looking at those data as well, and we expect to hear more about this important issue, which I know affects a number of people in British Columbia as well in the near future. I also want to make sure that you know that we are also looking at whether third doses or booster doses are needed for populations in British Columbia. As you know, we've provided a third dose to complete the series for people who are immune compromised, as well as starting a booster dose for residents of long-term care. We are looking at other populations, and we'll be gathering that data and looking at how we might roll those out in the future. I want to assure everybody that we have enough vaccine for everyone, whether it's for someone in long-term care, for a first dose for children, or if and when a booster dose will be needed. As I've said before, we will weather this storm by all of us continuing to do our part and supporting each other along the way. And I think right now, after this weekend, it is particularly important for us to thank healthcare workers across this province. It has been a long, hard road, and we know that you are showing up every day and caring for people across the province who need the services that we have in our healthcare system. And I want to add my gratitude and thanks to our healthcare workers. We need to continue to do our part by following all of our layers of protection. We need to do this with resolve and determination, as we have been through this last 20 months, as well as our commitment to each other to get through this by being kind to each other, being calm and being safe, and getting vaccinated. Thank you.
Thank you very much, Dr. Henry. I wanted to start today by speaking about the situation in the Northern Health Authority. And just to put it in context, over the course of the pandemic, different areas of the province have been affected by COVID-19 differently, and we have all supported one another. We've all been all in to support one another throughout the pandemic, and that continues to be the case. The situation in Northern Health Authority is extremely serious at the moment. I just want to lay it out with one set of facts. We have now transferred critical care patients. 55 critical care patients have been transferred from Northern Health to hospitals on Vancouver Island, in the Fraser Health Authority, and Vancouver Coastal Health. Of those 55, 43 are positive for COVID-19. 42 are not fully vaccinated. 42 not fully vaccinated people transferred in critical care. Over the Thanksgiving weekend, yesterday, Monday, Thanksgiving Monday, 4 people were transferred from Northern Health to either Vancouver Island or Metro Vancouver. On Sunday, 1, on Saturday, 5, on Friday, 4. That's 14 people transferred. I want to put in context these numbers in terms of the critical care beds that are in place for everyone in Northern Health, that usually, in fact, more than satisfied demand. They're in ordinary circumstances, pre-pandemic circumstances for critical care, although there are many challenges everywhere in our healthcare system. That is regularly the case. We have 40 critical care base beds in all of northern British Columbia. There are 42 patients with COVID-19 from the north in critical care, not just sick enough to be in hospital, but in critical care today in hospitals in the south. There are 23 further surge beds that have been added to our critical care capacity in the north. That makes 63. We have patients in those beds, in the base beds today, and obviously the pressure of hospitalization in all our hospitals, particularly in UHMBC, where our staff of doctors and nurses and health sciences professionals and healthcare workers are doing simply epic work to support people, dealing in particular with COVID-19. This is where we find ourselves today. 55 patients transferred over the weekend, over this Thanksgiving weekend, 14 patients flown from communities in the north, hundreds and hundreds of kilometers. It's about 800-900 kilometers by air as the crow flies from Dawson Creek to Victoria, for example, transferred this weekend. That's how they dealt with their Thanksgiving weekend. And I want to assure everyone in the north, we are all in to support them. On contact tracing, on support for healthcare workers, 55 transfers. We added 2 planes that we have worked with the private sector to add to our BCHS fleet over the weekend. We are all in to support them. But the people I want to speak to today are people who today are walking in communities in the north. Because the people in critical care right now, we're just going to provide them with the best care in the world and support their families and do whatever it takes to help them and help them get well from this vicious, nasty virus. But for those people walking around unvaccinated, who might be in those critical care beds in 2 or 3 weeks, I say to them, now is the time, surely. Now is the time to get vaccinated. With the whole healthcare system all in support, now is the time to get vaccinated. And I'm going to read off some of the clinics, some of the locations of the clinics across the north. And this is true, by the way, of everyone in BC who's unvaccinated and needs to get vaccinated right now. At the Lake Districts Hospital in Burns Lake, at the Chetwynd Primary Care Centre, the Tansy Friendship Centre, at the Chetwynd and District Rec Centre. There are different immunization clinics coming up. At the Dawson Creek Health Unit, at the Stikine Health Unit Centre for the Dees Lake area, at the Fort Nelson Health Unit, the Fort St. James Health Centre, the Fort St. John Health Unit, the Northern Lights College campus. There'll be vaccination clinics at Old Fort Road. In Fraser Lake, at the Fraser Lake Community Health Centre. In Grand Isle, at the Grand Isle Health Centre. At Rinch Memorial Hospital in the Hazelton area. At Coast Mountain College in Houston, at the Hudson Hope Health Centre, at the Kitimat General Hospital Multi-Purpose Room, at the Mackenzie District Hospital, in Macedon area at the Howard Phillips Hall, in McBride area at the McBride Health Centre, in Prince Georgian area at the Carriacicani Family Services and the CN Centre and the Prince George Conference Centre, in Prince Rupert, the Core Space, the Charles Hayes Secondary School, Prince Rupert Community Health Centre, in Quesnell at the Quesnell Senior Centre, in Smitherson area at Coast Mountain College Smithers Campus at the Healthy Living Centre, in Southside area at the Southside Health and Wellness, in Stewart at the Stewart Health Centre, in Terrace at Coast Mountain College at the Terrace Health Centre, in Tumbler Ridge at the Tumbler Ridge Medical Clinic, in Valemont at the Valemont Health Centre, in Vanderhoof at the Vanderhoof Health Unit, in the village on Haida Gwaii, the Haida Gwaii Hospital and Health Center. I just want to say to everybody that we need to come together now and raise vaccination levels. You know, and I know, the vaccination levels are high across BC. 88.8% in our province, across our province, 82.6% fully vaccinated of all those over 12, which is impressive by any standard, but we simply need it to be higher. And I'm asking everybody to be part of this effort, to continue to be part of this effort, and to continue to support this effort. As Dr. Henry has said, the requirement for mandatory vaccination in long-term care and in assisted living comes into place today. And I just want to take you through some of the numbers with respect to that so that you have a sense of where we are and the preparations that have been made for this important and significant milestone, not just for workers, but to keep our long-term care homes safe. There are 546 long-term care and assisted living homes covered by the order. We had the data for 542. We're working with the other 4 care homes that we have. This reflects the data in 542 out of 546 care homes. We have 48,879 staff reporting in total in assisted living and long-term care. The number of people who received their first dose is 46,924, or 96%. The total of received second dose is 45,457, or 93%. The total remaining is 1,955. In assisted living, vaccination rates are slightly higher. It's 97% overall, 94% second dose. And so of the 7,789 staff reporting in assisted living, 7,555 have received their first dose, 7,322 their second dose, there are 234 remaining. In terms of long-term care across BC, there are 43,304 staff reported, 41,572 have received their first dose, 40,273 their second dose. That leaves 1,732 in long-term care. So 1,732 in long-term care, 234 in assisted living. I think that we would say that what that tells us is that we've seen from the time when Dr. Henry put the order into effect to present a significant increase in vaccination rates in long-term care homes, which were over 90% at the time, just over 90%, and are now over 96% across long-term care and assisted living. And we're going to continue to work with health authorities and care operators to make sure that all workers continue to have the support they need to get vaccinated. As a result of the change coming into effect, residents in the vast majority of care homes will have the same care as they do today, with the added confidence that everyone working in their care home is vaccinated against COVID-19. The province is working with health authorities and operators on a home-by-home basis to ensure that if workers do not make the decision to get vaccinated, contingency plans are in place to ensure residents continue to get the care they need. A lot of work has gone into this. And obviously, a significant portion of the remaining people who are not yet vaccinated or unvaccinated in the systems, a significant number of those are casuals and not scheduled to work these weeks, but adjustments have been made accordingly. If a long-term care or assisted living worker refuses to be vaccinated, they will be in breach of the Provincial Health Officer's Residential Care Preventative Measures Order, the Public Health Act, and employer policy. They will be subject to progressive discipline up to and including termination. The message remains: get vaccinated, protect yourself, protect your colleagues, and protect vulnerable seniors in long-term care. Long-term care workers who have received their first dose can, in certain circumstances, work pending full vaccination as long as they get their second dose within 35 days of their first dose and remain eligible to work. Additional measures, such as using PPE and rapid testing, will remain a requirement until they are fully vaccinated. With respect to contact tracing, I just want to report as to where we are. Since my last report, health authorities have hired an additional 43 individuals to support contact tracing, bringing it to 1,439 the number of contact tracers in place across the 5 regional health authorities and the Provincial Health Services Authority as of October 8th. That's 504 in Fraser Health, 198 in Interior Health, 159 in Northern Health, 198 in Vancouver Coastal Health, 129 in Vancouver Island Health, and 251 in the PHSA. There are plans to add dozens more across the province, and I'll continue to provide another update this week. In conclusion, I just want to thank, after this weekend of Thanksgiving in our province, all those healthcare workers who are working in the communities, our exceptional staff, and teams of paramedics and dispatchers, people who are in the air and on the ground in BC Emergency Health Services, our healthcare workers, our health sciences professionals, our nurses, our doctors, our folks in the community who are continuing to deal with 2 public health emergencies with courage and the dedication that we have come to expect from them. The fact that we've come to expect this doesn't make us any less grateful. It makes us more grateful. And I want to express my gratitude to all of them. We are happy to take your questions.
As a reminder to media on the phone, please press *1 to enter the queue. You will be limited to 1 question and 1 follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Richard Zussman, Global News. Please go ahead.
Dr. Henry, as the province prepares to immunize children, can you give us an update on where kids may be able to get their vaccine? Is the province considering using doctors' offices, schools, community halls? How is that going to work? And how will priority be established for kids? Will we start with 11-year-olds and work down to 5-year-olds, or will it be based on regions, based on virus transmission?
We are still in the organizing and planning phase of that. To answer the second question first, no, it won't be. Often families have more than 1 child, so it will be all of that group. There's about 340,000 children between 5 and 11 across British Columbia. So yes, of course, we'll be highlighting communities where transmission risk is highest. That will be important, but we're trying to do a broad-based approach across the province to make sure access is there for everybody when the vaccine is available. And we'll be taking a number of different approaches. It probably will not be in physicians' offices yet. We're still waiting for details of whether the vaccine is going to be fridge stable and for how long. We had some early indications it might be, but right now we're hearing that it will need to be transported frozen and it will have a limited time in the fridge, but we don't know those details yet. So those are all things that we need to factor into play. But the other really important thing, and this has been important from the very beginning of this program, is making sure that we can document in our provincial immunization registry every dose that each individual has had. And I know there's been a few challenges, but our BC vaccine card is a good example of that. We know that that works because it is able to get that information from individual basis. And that's really important. It's really important so that we can monitor safety of vaccines and effectiveness of the vaccines. So we do not yet have a way for average physicians' offices to be able to enter the information directly into the immunization registry. However, we do know that physicians are really great at giving immunizations to children, and they've been a huge part of our mass immunization clinics. So I expect there'll still be a role for physician immunizers, but also the other immunizers who now are very experienced with the COVID vaccines. And so our immunization program, Dr. Ballum is working with our teams across the province to look at, to determine what is the best approach for different communities. For some communities, some of our more remote communities, we may be able to go in and offer, for example, a booster dose, making sure as well that we offer first and second doses for adults at the same time as being able to offer vaccination for younger children and do a whole of community approach. We know that was very effective for many First Nations and other smaller and more remote communities. So it's going to be a whole variety of different approaches. There will be some pharmacies that will be involved, but also health authority clinics in various different settings.
Richard, did you have a follow-up?
with October 24th fast approaching, proof of 2 shots for the vaccine card, what consideration is being given to event capacity? Has BC made a decision yet on whether we are going to expand capacity at that point, considering we're the only province this side of the Maritimes that has not increased the capacities to 100% in cities where there are NHL teams? So what's BC doing about capacity limits?
Yeah, those are things that I'm actively working on. Our intent was always, when the full vaccine card came into effect, that we would be able to go to 100% capacity and take away some of the other restrictions that we have in some events, like around dancing and remaining seated. So those are things we're looking at the epidemiology in different parts of the province and where this might not be in effect, and seeing the situation in the north comes to mind. So we will be making a decision about that by the end of this week. I know that people need to have some time to plan, but we are actively looking at that right now.
Our next question is from Lisa Cordasco of Vancouver Sun. Please go ahead.
Thank you. This is a question for the Minister of Health. We've been hearing reports over the weekend about people being on hold with 911 calls because no BC ambulance dispatchers were available to take their calls. I know the province is in the process of hiring 30 additional ambulance dispatchers, but I guess the question is this enough? And has the review group made any recommendations about how many dispatchers are actually needed and when or if you'll be able to hire more?
Well, you're right, Lisa. We're in the process of hiring both more ambulance paramedics and more dispatchers, and adding ambulance capacity both in urban BC and across BC and rural and remote communities as well. You've seen that reported. We're in the process of hiring, and we were in the process of hiring in the hundreds of new full-time paramedics in advance of this, and we're hiring a bunch more. There are from time to time challenges in terms of the resources and dispatch, but we've been adding in weekends when we've been under significant number of calls for ambulance paramedics. We've been adding and supporting ambulance paramedics with both management services and other supports at both the dispatch level and others. And certainly it continues to be a challenge because we're seeing right now in the healthcare system an increased call on ambulance care services. We've seen a lot more ambulance calls than we saw in the pre-pandemic period and through a good part of the pandemic, and we're responding to it by adding resources. And I think the issue will be, I think, addressed on the dispatch level by the adding of those resources. And it's my intention, and it's our expectation, I know it is, for BC Emergency Health Services to be ready and to provide care when people call for 911. And we're adding resources to see that happens. So a lot more ambulance paramedics, a lot more dispatchers. As you saw last year, we added air resources. Those are right now fully occupied, and we're adding more of those to deal with transfers from the north. So BCEHS has been seeing in the recent months, as you know, record number of calls, and we're responding to it by adding resources to make sure people get responses. And on the details of the weekend, I'd be happy to get you some detailed responses as well.
Lisa, did you have a follow-up?
Yes, thank you. So, Minister, do you believe then that these 30 ambulance dispatchers that have been hired, these additional ones, that is enough to cover the kinds of waits that we saw over the weekend?
I believe so, and we're in the process of hiring those and adding resources. And clearly, the support at the dispatch level is really important, as is having the ambulance paramedics on the ground, because our dispatchers and people who provide support are supported. It's a whole operation. It's not just the dispatchers. But yeah, that's a very significant increase in the number of dispatchers, and that's going to help significantly, as have other steps that we're taking. I think one of the most important steps, and it's really challenged right now because of the challenge in emergency rooms and some of the challenges in some regions of the province with COVID-19. But one of the most important ways is to ensure that ambulances get in and out of emergency rooms more quickly, and those are some of the measures that our team, our leadership team, at BCEHS have put into place during busy weekends throughout the summer, especially in the subsequent weekends when we had heat waves in July and in August. So it's a big challenge, but we've added since 2017 massive new resources to the BCEHS. With the exception of mental health and addictions, it's received the largest increases of any area of the Ministry of Health in that time, and we continue to do so now to meet this test. And we're hopeful as well that as we return, and we hope to return to more normalcy in our primary care system, that all of that will also relieve some of the pressure on BCEHS.
Our next question is from Lisa Yuzda, News 1130. Please go ahead.
Hi there. I'm wondering, just regarding the number of people who still aren't vaccinated, just a couple of things. You know, I remember back in, I don't know if it was June or July, when we were thinking that 70% was going to be enough to get us back to normal, and now we're, pushing 90, and it's still not enough. So I don't know if you can talk about your frustration, that the people who are getting sick now are getting sick because someone at some point has chosen not to be vaccinated. And are you surprised at how high it needs to be to give us the protection that we need to be able to function as normally as possible?
Yeah, these are really good questions. And I think what we're seeing is a very high rate across the board. And yes, it was higher than what we originally thought we would need to be across the board. And that is a reflection of the change in the virus. And the increased transmissibility has meant that it spreads more rapidly. There's less leeway in breaking precautions, and we've also started to have to try and get back to some degree of normalcy, and that's where things like the vaccine card come into effect, because we know we can mitigate that risk. We can't get rid of it entirely but we can make it much, much less if only vaccinated people are together. But we also see that the people who are not yet vaccinated, it varies by community. And so there are pockets where it's very low. But if we look at some of the communities where it's high, areas where we have had a lot of transmission in the past, like in parts of Surrey, in Vancouver Coastal, where we are seeing good protection, that this virus just runs into walls when we have those layers of protection that include most people being immunized. So it really is looking at those communities where there's issues, where there may be an increased level of suspicion, where there's concern about whether we're overreaching the government response, and tackling the individual issues for people in those communities. And we're seeing this make a difference. We're seeing it making a difference for healthcare workers who had questions and now needed to make a decision. And most of them, thankfully, are making the right decision, which is to protect themselves and their communities. So we need to continue to do that, to be that voice of rational thought, to help people understand what credible information there is to support their decision making, and to make sure that vaccines are available in those communities where people have that opportunity to make that right choice. And it's so, so important right now. As the minister was talking about, it is people in communities where this virus is circulating, and it's everywhere here. Where it's not taking off is where we are protecting ourselves and each other by being vaccinated. And that's what we need to focus on for the next few weeks, because it's going to get harder before it gets easier. We know that we have influenza coming. We know that we are starting to see other respiratory viruses cause illness. And when people come together, that's what's going to happen. The strain that we're seeing, which is almost all Delta virus across this province, it spreads rapidly when it finds a toehold, when people are not protected through vaccination.
Lisa, did you have a follow-up?
Yeah, and I'm going to sort of double end this. Like you mentioned, Dr. Henry, there saying it's going to get harder before it gets easier. Is there anything more that you can do to corner the people who haven't got vaccinated? I mean, you're taking jobs away from people if they're healthcare workers. There's, an umpteen places people can't go if they're vaccinated. Is there anything more you can do there? And also, you mentioned the flu shots. I know there's a lot of parents who are antsy wanting to get their kids vaccinated and are not seeing the clinics yet. is there a delay in flu shots, or is this a regular season and people are just more antsy about it this year?
So flu shots, yes, it's not a delay. We generally do it near the end of October, middle end of October. We've started to receive flu vaccine, and it will be available. And we're doing a large push this year. Like last year, we know that community pharmacies are a really convenient place for people to get immunized against influenza. So we'll be doing more about that in the next few weeks. We've started in the highest risk settings, as we do every year. So long-term care, healthcare workers, it's available now. And starting next week, it'll be broadly available in communities around the province, primarily through physicians' offices and pharmacies like we have in the past. And it is important this year. We've not seen a lot of influenza yet, but we know that with more travel internationally and more travel within our communities, that influenza spreads more easily. And I will caution as well, we know that influenza spreads really easily amongst younger children. It can cause severe illness in especially infants and young babies, but it can also cause severe illness in school-age children and can spread really rapidly. So these are the things that we need to start thinking about right now as we move into the fall. And in terms of what can we do, I think we need to go back to those communities where we're starting to see the impact. And I had the privilege of talking with a number of our First Nations leaders last week, with community leaders, about making the case that we now are seeing the breakthrough in some cases, but primarily what we're seeing is people who are not vaccinated getting really sick with this virus. This virus has changed. It's not the same as it was last summer, where young, healthy people had relatively mild illness. We are seeing severe illness in young people without underlying illnesses, and that is what is overwhelming in some cases our health system. And it also means now that people who need other types of health services are not able to get it in their community. So we need to go back to those basics. For young people who thought that they could just weather this, you need to be vaccinated. That is your protection from severe illness right now. And it makes a difference. Today, tomorrow, get your vaccine. As well, we need to start doing those things, keeping our groups small, making sure we're protecting those who don't mount as strong an immune system response. And we've been giving third doses to some people. But even then, if you have somebody who's going through cancer treatment, if you have somebody who's too young to be immunized, the most important thing you can do to protect them is to be vaccinated yourself. We've seen increasing evidence of this, that having others in the family immunize protects those who can't mount a strong immune system response themselves or who are too young to be vaccinated yet. So these are the important things that we do to keep our schools open, which our children need so much. These are how we keep people healthy in our family and our community.
Our next question is from Raw Shaw, Check News. Please go ahead.
Oh, hi, Dr. Henry. I just wanted to ask about the U.S. CDC rules again on the AstraZeneca doses. What is going on there when you talk to them, why they won't approve our mixed doses, and how confident are you that you can convince them to do that? What is the holdup and hesitation there?
Yeah, I think I can't really comment on how decisions are made in the U.S., but there's a number of different bodies who are involved. They have a strong ACIP, their Advisory Committee on Immunization Practices. But I also think they had a very structured approach to how they were providing immunization in the U.S., and it was really following the manufacturer's recommendations. We have taken a more flexible approach using what we knew about immunology and the fact that extended intervals have been shown with other vaccines to have a stronger, longer-lasting effect. And we're now seeing the data that shows that that was correct, that worked. and it worked better to support people. So now that that data is being published, and our team at the BC CDC is part of that, across Canada, in Quebec, Ontario, we've had similar results. And in Canada, we're one of the countries that is leading the world in publishing this data about the effectiveness of the mix and match schedules, whether it's 2 different doses of mRNA vaccine or whether it's AstraZeneca and an mRNA vaccine. But we're not alone in this. There are many other countries that are using these mix and match schedules as well, and that data is starting to be available and be published. So once that is all synthesized, I am confident, although I can't guarantee it, but I know that that my colleagues in the U.S. are looking at these, seeing that it works, and seeing that it might be important for the U.S. as well, as they're starting to introduce booster doses to augment the effectiveness of different vaccine schedules that they have in the U.S. In particular, there's a lot of concern about whether there's a booster dose needed with Johnson & Johnson now, and whether it would be better to use an mRNA vaccine as a second dose for that. I also think globally this is really important. We don't want countries to have to hold doses back or wait for manufacturers to be able to give people the full protection they need when they're seeing outbreaks in other countries. And we saw this in India, for example. So it is really important globally that we're able to use whatever vaccines are available to support people to have good protection. And that's one of the things that we're seeing with our program that we've had here in Canada that supports that. And that means that we can get more people protected faster globally, and that protects all of us.
Rob, did you have a follow-up?
Sure, thanks. Just to build on Richard's question about the idea of opening arenas and concerts up again. At the end of August, when you announced the vaccine card program, and then a little bit later with masks, you kind of sketched out what the fall might look like, revisiting the arenas issue, revisiting the masks in January maybe. Are we where you thought we would be now in the middle of October when you made those decisions at the end of August? And if not, what does the rest of our fall look like? Are we still looking at January as the kind of date when you revisit the things you put in place in late August, or maybe you can sketch that out for people?
You know, I think what we're learning is that so much depends on what's happening in your community. We're seeing right now that the North is a challenge, and part of that is related, and it's not universal across the North. There are some communities, particularly in the West, the Northwest, Haida Gwaii, for example, Prince Rupert's, where vaccination rates are really high, and we're not seeing that type of transmission. But there's other communities where things are not going as well. We look at Fraser East, where we see a lot more transmission and COVID in the community compared to Surrey and other parts of Fraser Health and Vancouver Coastal, the Lower Mainland. So it is in many parts of the province where I hoped we would be, and I think I can signal some, that we're looking at that in a more regional basis now. So it may not be as we had hoped in August that we would have the same approach across the province, but I think, I think I said in August that I was hoping we'd see a full arena for a Canucks game or for a concert, for the symphony. I think in many places, parts of the province, that is still in the cards. I think masking is going to need to be with us for a while longer. We know, and now there's some good evidence that keeps coming up, that even in fully vaccinated populations, when you're crowded together indoors for a period of time, it makes it safer for everybody to be wearing masks. So that part of it may need to stay for longer.
Our next question is from Zhao Zhu, Globe Mail. Please go ahead.
Thanks for taking my question. Will the province reveal vaccination rates in individual care homes? If there is 5% of the workforce unvaccinated, is there a place where those numbers are higher than others?
By health authority, the answer is yes, and we provided the sort of preliminary numbers this week, but those numbers continue to be the case in terms of Assisted living, it's pretty stable across the province, so 95% in Interior Health, 96% in Fraser Health, 99% in Vancouver Coastal Health, 97% on Vancouver Island, and 94% in Northern Health. Obviously, there are fewer overall numbers in assisted living across the province. There's 7,789 staff reporting. In the more significant area, which is long-term care, number is 94% in Interior Health, 97% in Fraser Health, 98% in Vancouver Coastal Health, 95% in Vancouver Island Health, and 89% in Northern Health. And those are the first dose numbers across the province by health authority. I think it's fair to say a very small number of care homes. I think the number, if you look at all care homes with more than 10 employees, I think it's 4 or 5 that are under 85%. And we're going, and we've gone through plans through care home by care home to ensure that we're ready for especially this first week of transition, because these are the first shifts where the provincial health order will be in effect, and people who are not yet vaccinated will be entirely excluded starting today. So there is differences between care homes, but as you can see, the numbers are very high everywhere and significantly higher than they were a while ago. And it's our obvious hope that we're going to continue to make even more progress this week. There's been very significant preparations for this in the Northern Health Authority, for example, where we've provided additional supports to certain care homes already to ensure that they're able to maintain the high quality of care you'd expect. I might add that we've added thousands of care workers in the last period across long-term care in BC, and that also supports us as well, and we're going to continue to look to that. But look, regardless of all of that, regardless of the fact that some of the significant number of the care home staff who are not yet vaccinated are casual, and its effect isn't, and the vaccination rate is very high at 96% in long-term care, 97% in assisted living, there is no question that this represents a challenge for us, and we are fully mobilized to the task of supporting care homes and making sure that for residents in long-term care, they continue to get the support they need.
Did you have a follow-up?
Yes, I do. I'm wondering if there are some care homes are struggling with staffing. We were told by the ministry staff last week that the government will allocate resources as needed if some regions are going to face a major staffing shortage. Could you please elaborate on how is this going to work? Like, where will these resources or workers come from?
Well, this has happened from the beginning of the pandemic. It obviously particularly happened in Wave 2, and in the case of some care homes, I think the Little Mountain Care Home, I believe it was around 90 care staff from Vancouver Coastal Health went in to support that, including at the time a vice president who went in to work there every day at Vancouver Coastal Health, and we are going to continue to do that. So those resources in those care homes that are there's a relatively small number of care homes that require such support. We're going to seek all of the means we have, and that will include moving and adding care staff to support care homes that are seeing a significant number of unvaccinated people. But overall, I'd say we're pleased with the number we're at right now. We're pleased that we're at 96+% in long-term care, 97+%, or 96%, 97% in assisted living. So overall, at a significantly high level. But we'd much rather be at 100%. And we're going to, yes, in some cases, should that be required, add resources to sustain care homes, especially the small number of care homes that are significantly below that. And that's, I would say, about 4 care homes across the province that are below the 85% mark, for example. Those have already received some support, but others who are going to face some challenges in the coming weeks, because this is in spite of the 96% and the 97% numbers, still a significant challenge at a time when healthcare is being challenged everywhere. And we're also preparing, of course, for the significantly larger challenge in terms of sheer numbers of workers, almost 3 times the number of workers who are still to come in the broader mandate for all healthcare workers that Dr. Henry and the Provincial Health Office put into place, and that work is ongoing right now, and that will be, in terms of sheer volume of change, an even more significant challenge.
We have time for one more question. Our last question today is from Isabel Brigham, CBC.
Hi there. This question is for Dr. Bonnie Henry, but if we can please get an answer in French. Will BC's vaccine card program be extended to include children 5 to 11 once vaccines are widely available for people in that age group?
That's a very good question, and one that we have not actually worked through, but my first thought is probably not. The intent of the vaccine program, of course, is to look at those situations that are discretionary, that mostly adults attend to, and we've made specific provisions for youth sports, for example, and other programs. So we'll look at that as we approach this, but the vaccine card is also, as well, not meant to be a permanent thing. It is to get us to that point where we can safely gather together because we have those high rates of vaccination and low rates of transmission in the community. So we're not there yet, clearly, but that's, it's one tool that we're using to try and be able to support businesses to stay open, to support the arts and culture and sports that are part of our lives, where the vast majority of people have been vaccinated already, and to be able to allow them to more safely gather during this period of time.
And just to say, 3,565,665 people have downloaded and have their BC vaccine card, which is a very impressive response from people in BC, and we are thankful for that real tangible show of support for the BC vaccine card program. I say, remember, the vaccines for children 5 to 11 are not yet approved in Canada, so it's going to be, and Dr. Henry's quite right. I think this category of people children have a different, will have a different need with respect to the BC vaccine card. But remember, the BC vaccine card program was announced in August, brought in September after people had a huge opportunity to be vaccinated. And so we are a good deal away from even considering a time when children 5 to 11 are in that category, although we're receiving very positive news in general about vaccinations of children. Je dirais en français que notre programme carte pour les vaccins dans la province a été annoncé au mois d'août et commencé au mois de septembre. On n'imagine pas, on n'envisage pas l'extension de ce programme pour des enfants de 5 à 11 ans. Il y a deux raisons pour cela. Premièrement, ces vaccins-là ne sont pas encore prêts au Canada ou d'ailleurs dans les autres pays aussi, mais ça va, nous pensons, commencer bientôt, mais ça va prendre des mois avant que des enfants sont en mesure d'être dans la même position que des autres gens de plus de 12 ans. Ça, c'est la première chose. La deuxième chose, c'est que la situation des enfants, comme vient de dire le Dr. Henry, est bien différente que des adultes, même des jeunes de 12 à 17 ans. Donc, je pense que les circonstances sont différentes pour eux, pour des raisons évidentes. Et donc, on ne pense pas, on ne songe pas actuellement à ce changement pour des enfants pour le moment.
Isabel, did you have a follow-up?
I did. Dr. Henry, what is your sense of how Halloween should go this year? What's your advice for trick-or-treaters and people who want to hand out candy? And how would you compare the situation to last year when we saw people getting creative with candy shoots and things like that? How would you compare it, and what can parents and trick-or-treaters expect for this Halloween? And Minister Dix, please, en français as well, please.
Right. And now that we finished Thanksgiving, we need to think about Halloween. You're right. You know, I do think that a lot of the creative things that we saw last year are good, and good things for us to consider this year as well, for a number of reasons. One is we still have transmission. We know that this virus is transmitting in communities around the province, and the new strain that we're seeing can transmit more effectively. And we still do not have vaccine for young children, particularly that age group that enjoys going out and trick-or-treating. So this year as well, I think keep it outside, keep groups small, do some of those really fun things that worked last year, having outdoor events for, especially if they involve children who are under 12 and not yet vaccinated. So I think that's a good thing to start thinking about for this year. And all of the creative stuff that we saw last year, I think bring it on again this year.
Oui, effectivement, pour l'Halloween cette année, je pense qu'il faut être quand même prudent, surtout dans des régions de la province où on voit le plus le niveau de transmission de COVID-19 la plus élevée. Cela étant, et je pense qu'on peut utiliser, comme vient de dire le Dr. Henry, notre imagination pour être protégé, mais pour célébrer cette fête qui est importante pour les enfants et pour beaucoup d'autres aussi. Mais les limites, surtout pour les adultes, sur les soirées, les limitations à ces soirées, surtout dans l'Interior Health Authority, Northern Health Authority, East Fraser, sont toujours en place. Et il faut être prudent et de suivre les règlements qui sont en place et de nous protéger tous. Donc, je pense qu'il va falloir de l'imagination, mais je pense qu'on peut avoir une Halloween qui va créer ses propres mémoires. Merci beaucoup. Thank you very much.